And hi, I think Barbara's with us, and Clarence and Kim. I want to thank you for joining us and telling your stories. I know it's never easy to share stories about that are personal health, but I really want to applaud you for doing that because I think this will serve as to increase awareness and warning, for others. And Barbara, of course, it's good to see you again. It's been a while, and I know you've been through a lot these last few months. Clarence and Kim, can you make sure your cameras work so we can see you real quickly?
I'm checking.
Kim, Marlon sends his regards. He's watching this too.
Okay.
And Clarence,
Can you see me at all? I can
we
see
cannot,
myself.
we don't see Clarence. We see everybody else, but not Clarence. You want to try again there?
Yeah, I'm a little technology challenged. Sorry, guys.
That's okay. That's why we want to get it right before we start here. I
Okay.
think the press might be on, but we'll be beginning in just a moment here.
Yeah, for some reason I see you and I see myself, but I just don't, I guess you can't see me.
Okay, could one of our tech people call Clarence on the cell phone to see if we can walk him through that? And Clarence, if that's okay, we'll give you the maximum amount of time. We'll just change the order to go to you after Barbara and Kim, just to give you a little extra time to get that going. So probably be to you in about 15, 20 minutes or so.
Sounds good. Thank you.
And somebody might call you offline,
Okay.
Ellie or whoever's on. And I'm ready to start. So if someone could let me know when we're ready to begin. We are now live, actually.
We're ready to begin.
Okay. One moment. Well, thank you all for joining us. Today, we're going to discuss the rising COVID numbers in Colorado and why that's concerning and what that means for ICU, emergency room hospital capacity, and non-emergency room hospital capacity. We're also going to hear from several survivors, so you can hear about what this coronavirus experience means to real Coloradans, our fellow Coloradans, and really hear firsthand what they've been dealing with. And before you joined us, I thank them personally for sharing their health stories. It's never easy to talk about your health in a public way, but it also is important for Coloradans to hear these stories. And I want to thank Barbara Gould, Clarence Troutman, and Kim Powell, all of whom experienced coronavirus, all of whom have thankfully recovered in various degrees after spending a very difficult time in the hospital. We're also joined by Scott Bookman, the Interim Director of Division of Disease Control and Public Health Response, Incident Commander for COVID-19. He will be our resource on answering any questions on the hospital presentation, and he'll be adding some information as well. Also have a fire update for you today. Today, 1,433 new cases, in line with these high levels we've seen over the last week. 538 currently hospitalized, and that continues to be an upward trend in both numbers and in hospitalizations. This is happening across the entire country, over 40 states, substantial increases, some steeper than Colorado. In fact, last Friday, the United States reported the highest daily case count since the pandemic began, with more than 80,000 new cases. And we continue to be concerned about the lack of a national strategy to turn this around, and a coordination between the states, which Colorado would, of course, be a willing and enthusiastic participant in. But in the meantime, we're certainly doing what we can here. And before we get to the hospitalization numbers, which are very important, I want to give you a fire update. We are all grateful for the snow that we experienced over the weekend. Of course, last week there was major fire activity. The latest numbers: Cameron Peak Fire, 206,663 acres, 64% contained, still 2,400 homes under evacuation. East Troublesome Fire, 192,560 acres, 20% contained, 7,040 homes evacuated. Middle Fork is at about 20,000 acres, 12% contained. Williams Fork at 14,700 acres, 35% contained. Calwood Fire, 10,100 acres, 76% contained. Left Hand Canyon Fire is now fully contained. Ice Fire, 90% contained at 596 acres. All the Boulder County evacuation orders have been lifted. I visited really areas impacted by all the fires last week. And we know there's a lot of certainty as these evacuation orders are lifted and Coloradans return to their home. Part of Estes Park remains under mandatory evacuation. Other areas, the evacuation order has been released and people can return. Rocky Mountain National Park remains closed with no visitors. Our priority is allowing, of course, homeowners to safely return to their home. We continue to do everything we can to support our local communities in their time of need. The Red Cross has provided shelter and meals to over 27,000 people who stayed overnight, 25,000 meals. And I want to thank the 231 volunteers who've worked with the Red Cross and others to help our fellow Coloradans that are not only being evacuated from fire danger, but also trying to be kept safe in the context of the pandemic in ways that are new and unprecedented with regard to fire evacuations. So over the last few weeks, we've discussed the concerning trend of we're seeing in Colorado, high positivity rate now approaching about 7 to 8%. Now, we don't really know the number of positive cases at the beginning because of the lack of testing at the beginning of the crisis. We are now hitting an all-time high with the number of cases detected. Hospitalizations also have been increasing over the last 7 weeks, which remains a great concern. And if these trends continue, it would exceed May hospitalization numbers, the highest that we had, by early to mid-November. And the modeling suggests that if we don't change what we're doing, it'll exceed all of the existing hospital capacity by the end of the year. This thing moves quick, and we need to change the way we live. We need to stay safer at home. We need to avoid social interactions. Of course, schools continue to be safe. They're back across our state. We've seen great evidence about the public health benefit of especially kids being in elementary school. We wanted to continue to encourage that. Obviously, for parents who aren't ready to send your kids back, they can continue online, but they're safe, well-regulated environments. Implementing strong safety protocols is really good for both teachers and students. And we're excited to see kids return to school across our state. My kids are, of course, in school, and we're really thrilled to see that. It's a little bit harder at the high school level, where the immunological impact of COVID is more similar to what it is in adults for 15, 16, and 17-year-olds. But many high schools are back, and some are hybrid, meaning they're just reducing the capacity in the building, going in 2 days a week. Others are just having kids come in for special ed and folk tech and those sorts of things. But we do want to encourage school districts to use your buildings, use your facilities, even if you're not back for full in person for high school yet. At least, some of those things like shop and auto repair, you really can only do, you can't do as well virtually. So those can be done with social distancing in a safe way. And it's really important for kids to get that. So hospitalizations, first of all, I want to thank all of our partners, the doctors, the nurses, the hospitals. Thank you for helping to work very hard at great risk to yourselves to make sure that Coloradans that need care, whether it's for COVID or something else, can get that care. That is absolutely paramount during this. We want to make sure that Coloradans get the best quality medical care, whether they have COVID or they have another condition. And in the scheme of things, one thing you'll see from the slides is Coloradans with other conditions. That means they need hospitalization outside of COVID. That's an even greater number than COVID. But we need to keep that capacity, because if you have a heart attack or a stroke or appendicitis, you need that hospital bed. They can't, it's not, you won't get the best quality care if all those hospital beds are a higher percentage are filled with people with COVID. So the first slide provides a snapshot of what our hospitalization capacity looks like today. Keep in mind that hospitals are complex, dynamic systems that change their bed availability really based on the situation almost every day. But before COVID, Colorado had 8,444 medical beds and 1,849 beds for all Colorado patients, right? COVID and non-COVID. Many of them were full on a normal day in 2019 and 2018. You would often see 70 to 80% of those beds full, just because that's what they're there for. Now, the surge capacity is about 12,588 medical beds, 3,782 emergency beds, 2,200 alternative care sites. And that surge, we would have the ability in about 2 to 3 weeks to do part of that. We could add about 360 beds, but the total capacity would take about 4 weeks. So it's when you look at kind of what that surge capacity is, that's over a 1 to 4 week period that has not been activated yet, although some of the hospitals, many of this is on the private side, are already making those plans to begin the call on increasing some of their ICU beds if they are needed. Under surge capacity, we can turn some of those medical beds into ICU beds, but it doesn't come without cost and challenge. It takes investment, staffing, supplies, and right now nationally, there continues to be a crunch on those supplies to sustain this over a period of time. So over 1 to 4 weeks, that capacity would come online if it is triggered. And at 4 weeks, you would see a capacity at or close to the surge number, as long as there is enough equipment and personnel to do that. So let's look at the increase in hospitalizations. This has been consistent over the last few weeks. We are now at our highest point since May. As of October 26th, 591 total hospitalizations that are likely COVID, most of them confirmed. There's sometimes a 24-hour lag on that. Another way to look at it, and if we could advance the slides here to slide 4, is that the total number of people in the hospital, but not so much that, but how many people are admitted every day, because some stay for a short period of time, others stay for longer. This gives us a snapshot of how many people are admitted every day. Highest 7-day average since May. And since September, our hospitalizations per day have doubled. We don't just closely monitor the overall number, but also the changes. This shows that a very alarming increase in hospitalizations over the last few weeks. Now, the next slide is key. It really shows the ICU bed usage statewide. Now, the question is not just how many people with COVID are in the hospital, but how many hospital beds do we have left, because people are in hospitals for other conditions. ICU beds are not just for COVID. People have heart attacks, traffic accidents, and many other conditions all the time, and Coloradans need that critical attention. So you'll see, while there has been a increase in COVID hospitalizations, that's that bottom line, the orange line on top has returned to close to normal numbers, right? People were deferring surgeries and waiting and not going in, which had its own health challenges in May and June. We were very worried that people that had chest pains weren't going in for potential heart attack because they might have been scared of COVID. If you were experiencing symptoms that would have led you to get hospitalized or call last year, you should absolutely go in and check it out. So those numbers have returned to close to normal, but add on top of that, that red line, that's the whole new piece. That's a COVID. You can see there's very little room for error in a normal hospital day. We don't, this is a private sector thing, and they're not building, years ago, they haven't built a bunch of beds just to keep them empty. They run in that, 80% range regularly. So this COVID piece is entirely on top of everybody that would need to be hospitalized normally. Now, there's a little bit of flexibility there. If some non-emergency procedures need to be deferred, they can be deferred for a period of weeks or months, but we did that once. We hope that that doesn't happen to have again, but it does provide a little bit of a safety valve there in terms of actually running out of beds. So here's another one, the medical. These are the non-ICU beds. It's similar here. There's a great number, back up to the normal numbers being used. And this is what the surge capacity at the convention center would provide up to 2,200 of, if needed. Those would roll on over a period of 1 to 4 weeks. The full 2,200 wouldn't be recognized for 4 weeks, but we do have that surge capacity there. The next slide shows us the same breakdown, but this is actually the average stay in a hospital. So, some good news here, but it's important to point out. So it was 6 days originally. Now the median stay in a hospital is 5 days. So as many people stay 2 or 3 or 4 days as stay 6, 7, 20, 30 days, but the median is 5, slight decrease from the initial days. And the next slide is the kind of the best news. It's the decreasing mortality rate due to better standards of care for COVID patients. Also sort of baked in here are the increase in younger people that get it. If you go to a hospital, right now, you have about a 4 to 7% chance of not making it out. That is the mortality rate. So that was 15% back in March. 15% of the people that enter the hospitals didn't exit. Now it's around 4 to 7%. The October number will likely be revised up because October isn't over. But somewhere you can see that August was about 5.5. So somewhere in that 4 to 7% range, if you have to be hospitalized, that is the percentage of people that will not make it out. The rest will after a median stay of 5 days. Doesn't mean that's pleasant. The folks on the call today made it out and were there for more than 5 days, but they're going to talk about how that is very difficult. It's a, even if you're one of the lucky ones, and the 3 people on this call are among the lucky ones, they were not in that 4 to 7% that didn't make it. It doesn't mean by any means that it is easy for you or that you can even regain your life quickly the way that it was before from a health perspective. And, this raises an important point. Every day we make medical gains and advances. It is better to get COVID now than it was 6 months ago. And it'll be better to get COVID 6 months from now than it is today. So the longer that we can prevent people from becoming infected, the more likely it is that better care will not only increase the survival rate, but also be able to reduce the severity of those who experience symptoms for the long haul. So that's another urgent reason to kind of do what we can to wear masks when we're out, limit social gatherings, stay safer at home whenever possible, and limit the spread of this deadly virus as medical technology improves. And it already has shown significant improvements, will show even more. And then, of course, the vaccine is a preventative. That is different. That will be hopefully available November, December with the first doses, and then significant dosage available early next year. Finally, we know that COVID is not affecting all communities equally. To talk about some of the disparities, as well as the modeling, which you can see about when or if and what scenarios we would exceed our hospital capacity, I'm going to turn it over to our emergency incident commander, Scott Bookman. Scott? Okay, if Scott is not with us, we are going to go to Barbara Gould to share her powerful story of her own personal experience with COVID-19. Barbara? You unmute yourself, please, Barbara. Unmute yourself, please, Barbara.
Got it. Okay. Thank you for having me, Governor. I'm going to go through this pretty quickly. Can always ask questions later. And I did make some notes so that I don't forget anything and also so that I don't ramble. Due to COVID, I was in the hospital for 91 days. I was on a ventilator for 65 days, and ECMO, which is a lung bypass machine. It's really quite more than that, but you'll have to look that up. I was on ECMO for 15 days of those 65 days. On March 15th, we returned home from a trip on a flight from Atlanta to Denver. The man sitting behind us was coughing for the entire flight. There were no protocols in place at that time. When we got home, my husband became ill with COVID a few days after we were home. No cough, fever, chills, digestive issues, indescribable fatigue as well. I developed a cough, which is something that often happens after I travel. But we were in touch with our medical personnel at our professionals at Boulder Internal Medicine every day. And my cough got worse. On April 7th, I felt a pressure in my chest that I knew was not right. And I called my doctor and I was admitted to Boulder Community Hospital. After 3 days, it became clear that I wasn't improving and I had to be intubated. I was on the vent there for 15 days. And ultimately, I wasn't improving. My lungs were like concrete. And Boulder community reached out to UC Health because they felt my last chance would be an ECMO machine. I actually didn't meet all the criteria to be on an ECMO machine, but UC Health accepted me. I'm very grateful for that. Let's see. It was clear by then that I was dying and that the ECMO was the Hail Mary, the Hail Mary, whatever you call it. And I had to be airlifted because it was so urgent to UC Health. I remained on ECMO for 15 days. And at one point, it looked like even that was not helping. And my husband had to have my living will in front of him at all times. And at one point, the doctors did call and say, it's not looking good, and we'll give it another couple of days, but this might be it. So at the time, my Congregation Har Hashem in Boulder, was supporting my family, my husband, my adult kids, never went hungry. They were praying. People were praying all over the place, which I also appreciate very much. I showed signs of getting better, and that was great. Let's see. You were talking about capacity before. I was lucky at the time that UC Health had the capacity to accept me. On June 2nd, I was able to, I did go to UC Health, I believe on April 25th. On June 2nd, I was able to leave finally, still on the vent, and I went to Kindred Aurora to be weaned off the vent and to regain some strength. At that time, I had post-ICU delirium. I couldn't lift my head. My eyes were weak. My muscles were atrophied, and I had to relearn how to swallow. My voice was gone. Kindred weaned me off the vent very lovingly, very professionally. And finally, I was able to get off the vent after 65 days. I needed then and still need now supplemental oxygen. Once I could walk a few steps with a walker, I was able to go to the UC Health rehab facility in Broomfield. On June 29th, I left Kindred to go to rehab. I left there being able to walk for several minutes, still using a walker. I could climb some steps. My voice was a little bit stronger. And on July 14th, I was able to come home to my family. It was 90 days. After that, I had to have home health care until October 1st. Boulder Community Health care. I'm going to UC Health Pulmonary Clinic to see my docs, still in Boulder Internal Medicine, and doing pulmonary rehab at BCH. I was a healthy, active person pre-COVID. And I have a long road ahead of me still. And it's too soon to tell, and I think others will probably say the same. It's too soon to tell what the new normal is going to be. My liver sustained some damage. Don't know if that's going to get better or how long it will take. My endurance is greatly weakened. We don't know how long that will take to rebuild. Don't know if I'll get off the oxygen. I hope so. My family and I have PTSD that can be overwhelming. My voice is actually pretty strong today, but this is not really my voice. It's still hoarse and sometimes it goes out altogether. My lungs are mostly clear, but there is fibrotic scarring that is around the edges, and I don't recognize myself. I am very grateful to be alive. I am so grateful to all my healthcare workers, to my family. There are many of us out there. I should say also, my hair fell out, all my hair. It's coming back now, but you know, that was a thing. There are many of us out there like me. And, you know, we don't have statistics yet for that, but this is a serious illness. And, you know, I never said why me, because the answer really is why not me? We just don't know. And for people who think they're immune or they won't get as sick, you just don't know. So it's important to be very careful.
Thank you, Barbara. And this is a picture of you just from this last February. And I actually, as you know, I know you, and that's how I knew you. I would scarcely recognize you today.
Yes.
And that's the Barbara I know, and I hope that will be you again when you recover. But it also puts a human point. It's very clinical when I talk about hospital capacity and beds. That made the difference in saving your life. If there was not that bed available at ICU in Denver, in Denver. UC Health, you very likely would not be with us today. So
I definitely would not have been with us today.
So I mean that hospital capacity sounds
no doubt
critical.
about it.
Yeah, and that is absolutely critical. And that quality of care you got made the difference. You have a long road ahead of you, but thank you for your internal strength, Barbara, and thank you for taking this step of sharing your story. And it's just so important and powerful. I now want to turn it over to Kim Powell, who has another harrowing story of her own struggle with coronavirus. Kim?
Hi, can you hear me? Okay. First of all, thank you to Governor Polis and the First Gentleman, Marlon, for having me to tell my story, and to Barbara for sharing the really traumatic situation that she continues to go through. So my name is Kim Powell. My pronouns are she and her. I'm a family nurse practitioner. I'm from Denver. I've had more than 22 years of experience in nursing. I was in excellent health. I've never been a smoker, mostly vegan. I cheat sometimes. And I was always on the go. I was a runner, and I often would drive my partner nuts because I would race to the top of the mountain, and that's just who I was. I'm a drummer. I love to belt out show tunes around the piano with friends, but these were the before times. This was before I contracted COVID, and I was essentially plucked from life as I knew it. On May 22nd, I was hospitalized. I had sudden hypoxia. Went from feeling not so great to having a pulse ox of 76, not being able to breathe. And normal is above 90. And I was lucky. I was very lucky. I was only inpatient for 2 nights. I was released home, and I have so much privilege. I was able to receive in-home virtual hospital care, and I was able to receive supplemental oxygen at home. I made it through continuous headaches, shortness of breath, extreme fatigue, 20-pound weight loss, really high blood pressures, chest pain, vision changes, all of the things. And in August, I thought I was finally better. I started cardiac rehab in hopes of running again. Part of my baseline is that I'm an optimist, and sometimes that's helpful and sometimes it's unhelpful, but I thought I would run again. And 3 minutes into the walk test for cardiac rehab, my oxygen level plummeted into the low 80s, and the cycle started again. So today, anything more than a slow walk to the mailbox requires oxygen. I haven't been able to do many of the things that used to bring me joy. I can't run. I can't go to the mountains. I haven't regained the stamina or my grip to be able to play my drums again. I can sing, but it's exhausting and it really sounds terrible, but I still try. And I'm grateful that I can now speak without becoming too short of breath. And the headaches are gone, the chest pain's better. I do have some lasting reminders, aside from my oxygen tanks. I have 6 pulmonary nodules in my right lung, my right lower lobe, which weren't there before. And on Friday, I had a cardiac catheterization, and my arm is still it's like ready for Halloween. And that is showing that I might have what looks like a shunt that wasn't there before, causing problems between the circulation with my pulmonary and cardiac circulation. So my hope is that sharing my story would be to shed light in the gray area of what it can look like to be a COVID survivor. Many of us experience survivorship silently, and this continues to be a frustrating uphill and muddy battle. It's affected every organ system in my body and every person in my life. But without my many privileges, being white, having gender passing privilege, education, housing, access to healthcare, economic privilege. I mean, without these privileges, I would certainly not be here to share my story today. It's essential we remain vigilant and wear masks, socially distance, and temporarily adapt to keep ourselves, our loved ones, and those we've never met safe and alive. So thank you again for having me, and I'm grateful that I'm here to share my story.
Yeah, Kim, thank you for sharing that powerful story. It really emphasizes how while 4 to 7% of those who enter the hospital won't make it out, many of those who do make it out, like you, like Barbara, are not the same as you were before you went in. And nobody knows whether you're going to be dealing with this for another 3 months or 3 years or forever. I hope it's only 3 months, but nobody knows because there's not enough time or data about this horrible virus, and nobody knows what it looks like 1 or 2 or 3 years after. And so, unfortunately, you're kind of learning by example there, and you'll be among the first. But I wish you a complete and speedy recovery, as we do for Barbara. Clarence Troutman, who's joining us, has his story of battling COVID. Clarence.
Okay, I hope you can hear me now.
Yes, we're good.
Oh, thank you so much. Hello to everyone. Like Kim, I'm thankful to be here. Thankful every single day. It's been quite a journey.
Clarence, we lost your camera again. It was showing you and then it stopped showing you.
Oh,
If you want to resituate that, we can do our other update now if you want to work on that for a few moments. I think we almost had it working, but why don't we come back to you, Clarence, if that's okay? And we'll go to Scott Bookman now, and then we'll return to you, Clarence, in about 3 or 4 minutes, okay?
okay.
Thank you. Scott?
what I did. Hello?
Scott, you're unmuted.
Hello? I don't know what I did again.
Scott, you there? Okay, well, I do see Scott's presentation and I can talk about it a little bit. Essentially, what this is showing is that every age group has seen an increase in hospitalization. The median hospitalized age is 57. That's important to know because a lot of people think, oh, it's other people that get hospitalized. Well, no, it's every age group. That's very close to the median age in our state, 57. It's gone up for 30 to 39-year-olds. It's gone up for 40 to 49-year-olds. It's gone up to 50. So every age group has seen the increases in hospitalization rates with the outbreak of the virus. The next slide shows that while it's affected everybody, it also is putting in danger our capacity. We talked about that surge capacity, right? We're at that just under that 2,000 line currently, the ability to increase it with notice. But without that surge capacity on the current trajectory, it would likely exceed our hospitalization capacity very soon. That shows the reason we need more transmission control. Look how nice that red line is, that green line is. What those mean is that we need to do a better job staying safer at home, wearing masks if we have to go out, avoiding groups and get-togethers. Specifically right now in Colorado, you cannot have a get-together of more than 10 people legally and no more than 2 households at once. And I recommend you don't even do that. I mean, if you have to socialize with a neighbor or you have a certain bubble of 3 or 4 people you socialize with at different times, that's fine. But now's the time to shrink our bubbles, to be more careful. We've got to get control over this in the next few days and weeks, folks, heading into the holiday season, heading into so much promise, right? A vaccine, better therapies and cures, all of that on the horizon. But we don't want to squander that by easing up now. We've been through so much. Let's get through these next few weeks together and show our strength as a people in helping to save lives and get our economy going sooner rather than later. Clarence, we're going to go back to you. We do see you, and we'd be happy to have you join us to share your story. Clarence?
I hope you can hear me okay now.
Yes, everything's good.
Perfect.
Thank you so much. Yeah, basically, I just wanted to kind of reiterate a little bit what Kim, everyone else has said. I'm thankful as heck to be here.
I'm sure you just.
The story is in some ways similar in that it was a very healthy, at least I thought so, 59-year-old. I'm a broadband technician for one of the local phone and internet companies here. And around the last part of March, first week of April, I got sick as heck. At first, I thought it was just a bad cold or flu, but it just got worse and worse and worse. So by April 4th, I had a fever that had set in that just wouldn't go away, and I couldn't breathe. And that's one of the worst feelings in the world. I hope nobody ever has to experience that. So at that point, we called an ambulance. They took me to UC Health at the emergency room. And maybe the last thing I remember from that time was them kind of emptying my pockets and talking to my wife and telling her everything that was kind of going on. The next thing I can remember is waking up, I think it was 27 or 28 days later, where I'd been in ICU and I had been intubated for right around a month. And a great deal of that time I was in a coma because they were kind of still trialing different things and seeing what would work best, what wouldn't work, that sort of thing. And while I was intubated, I was turned over on my stomach, on my side, all that sort of thing. And again, I had no idea what was going on until I woke up later in the month, and one of the nurses asked me, well, do you know where you are and what's going on? And I told her, well, no, I have no idea. All I could see was a dark room with some windows shuttered and a bunch of people around with machines beeping everywhere. And at that point, she told me, well, you're at UC Health, been here for right at a month. You've tested positive for COVID-19. I cried for maybe 10 minutes. And then had her explain the rest of the situation to me, what was going to happen from then. So I spent maybe another week in ICU recovery where they had to teach you, as was said before, how to eat again, how to speak again. I was one of the experimental tracheotomy people, so I wasn't able to really speak for about the first week or 10 days when I had awakened. But eventually, they kind of got me stabilized there in ICU. And I was fortunate that I was moved to a rehab center right there at UC Health. So all I did was kind of change floors, and they started kind of working on me from there with things like, again, learning how to eat again, walk again, talk again, and that sort. So after 58 days, I was discharged back on June 1st. And since then, it's just been kind of a battle to try to get back to where you were, at least as close as possible anyway. So I'm still having a ton of doctor's appointments, pulmonary rehab, CT scans, things like that. Because as you said before, you're not sure if this is going to last another 3 weeks, 3 months, or 3 years. It's just kind of an ongoing process. But I can tell you for sure that I am one of the most thankful guys alive. I am so happy to be here, and I can't commend the people at UC Health enough. They've really worked wonders in my eyes. I think the other thing that sticks with me is when I hear certain people say that this isn't real, or it's just a bad cold or a flu, or even that it's a hoax, that I find that very disturbing, because it's so much more than that. It's 100% real, and we can't do too much to be safe and protect ourselves and protect those around us. Because when you go through this, it's not just you, it's everyone around you. It's everyone that you love and loves you. And I think in some ways they suffer more than you do. I don't wish this on anyone. So I just hope that going forward, that as we gain knowledge, experiences through different people like ourselves, we can hopefully get a better handle on this. And it sounds like here in Colorado, we've done some great things, especially compared to some of my relatives and friends that live out of town, what they've described to me. I think we're actually ahead of the curve quite a bit. And I just hope that that'll continue, because again, I don't wish this on anyone.
Thank you, Clarence, for sharing your powerful story. Two things that we're doing in Colorado are we have free, quick, and easy testing, lots of different places, very little wait. So anybody experiencing those symptoms, get tested, because even if you're positive and it's a minor symptoms for you, you then know that if your relative or somebody you were exposed to starts developing more severe symptoms, they might need to be hospitalized. And also you can quarantine yourself for 14 days. So that's very important. There's over 80 testing sites across our state. Only takes 15, 20 minutes, sometimes a little longer depending on the time of day. COVID19.colorado.gov. You can find a free, quick, easy testing site near you. The other is we just launched our COVID-19 exposure notification system. It's on a Apple operating system and Android. The phone notifies you. It totally protects your privacy and the privacy of those around you by opting in. It shares an anonymous token. If you've been exposed to somebody who has the app who was contagious with COVID, you will be notified so that you can take the steps you need to protect your family and your loved ones. So also very important. But look, to be blunt, if we don't do better in Colorado, then more Coloradans will die unnecessarily. It could be your neighbor, it could be a relative, a friend, a family member, it could even be you. And even if you're one of the fortunate ones who make it, I think you've heard from Kim, from Clarence, from Barbara, that even if you're one of those that make it out, you're not in that 4 to 7% who get hospitalized who don't make it. It doesn't mean that it's easy or clear or free. It's a long, difficult path. Regaining your health. The secondary effects of COVID are just being studied, just being learned about. But the best thing is to not get COVID in the first place. And that's where you come in. And that's where wearing masks whenever you're around others comes in, staying safer at home whenever you can, avoiding gatherings, and washing your hands regularly after you go out. This year, Coloradans have been asked to face a lot. Global pandemic, economic struggles, the three largest wildfires in the history of our state and other wildfires as well. And I know that we all long to get back to normal. But now is not the time to let down our guard. We can't stop doing what we know will save lives and prevent people from getting sick from this virus. The path we're on for the winter months ahead is up to us. Our choice, our actions, our responsibility as Coloradans, as Americans, as humans will decide Colorado's fate in this pandemic in the challenging months ahead. As we approach the holiday season, continue experiencing colder weather, let's step up. Let's do what's right for one another, for our communities, for ourselves. Wear masks, stay safer at home, avoid gatherings. And you know what? Before we wrap up today, I also want to make sure that people know that, of course, Coloradans have every opportunity to vote in person up until Election Day. There are never any health orders that affect the regular operation of early voting and voting sites. All voting centers remain open. Election Day is just 1 week ahead. It's too late to mail your ballot. You can drop your ballot in any official drop box. Or if you didn't get a ballot or haven't registered, you can go to any early voting location to register and vote right on site, including on Election Day. And COVID restrictions will, of course, not impact anybody's right to vote in Colorado. Thank you for joining us. A special thank you to Barbara, Kim, and Clarence for sharing your very personal stories. And hopefully by doing so, you can help prevent other people from having to experience what you've been through, really hell and back these last few months. With that, we'll open it up for questions.
Governor Polis, good afternoon. It's David Clue at Denver 7. I too would like to thank Clarence, Barbara, and Kim for their stories. And of course, we at Denver 7 wish them nothing but the best. In the meantime, the city and county of Denver, as you know, have chosen to move to level 3, safer at home once again. The specifics of what that means, the mayor says he's waiting for guidance from the state. So what is that guidance from the state right now? For example, when it comes to closing gyms, and if we don't have the answer yet, what are we still waiting for?
Requires localized strategies, because what we find is that there's different peaks at different times at different places. So for instance, take Boulder 4 weeks ago. Boulder County had one of the highest coronavirus rates in the state. The students were the biggest part, but it wasn't just limited to the students. They took important public health actions, and now Boulder is a much lower rate than much of the rest of the state. Now Arapahoe, Denver, Adams, all some of the highest areas of the state. We fully support Denver's efforts to contain coronavirus growth in Denver before it overwhelms hospital capacity, before it costs unnecessary life. And of course, we look forward to providing them with the very best scientific data to drive decision making.
Hi, Governor. This is Joe Vaccarelli with Denver 7. I know you've been urging people to wear masks and limit social gatherings, among other things, but do you feel there are Coloradans who are not taking the virus seriously? And if so, is there anything that leads you to believe they might start now? And also, if is there more the state can do on that end aside from reverting back to a stay-at-home order?
Yeah, unfortunately, there are Coloradans that aren't taking this threat seriously, and I really hope that they listened to Kim and Barbara and Clarence or others in their own family network or family that are battling this or have been through this. I have another dear friend now of 20 years that is currently intubated and hospitalized for coronavirus, and my prayers are with her, as they are every Coloradan who's experiencing this and everybody across the world who's experiencing coronavirus. So I hope that this is a wake-up call. I hope people see the need to make sure we have the capacity in our hospitals to serve people. It's not just some clinical thing about beds. It's about saving the lives of Barbara and many others to make sure that they have access to that quality of care, which in most cases will be able to save their life. But again, the best thing people can do is not contract COVID. And while we're not in full control of that, your behaviors have a big impact on that. By not going out except when you really need to, by wearing masks when you're around others, by not going to social gatherings, you are increasing your own odds of making it through this with your full health intact, as well as the odds of your own family and friends for making it through this, where more of this is behind us than ahead of us. There are many vaccines in phase 3 trials. There are better cures coming online every day. Let's really take it this seriously and buckle down these next few weeks to get this under control in Colorado.
Hello, Governor. This is Vinny Del Trudice at Bloomberg News in Denver. With cases up and winter approaching, how is the supply chain for PPE, pharmaceuticals, ventilators, etc.? Can Colorado get what it needs? And do you still see states competing for resources? Thank you, Governor.
The supply chain is better than it was in April and May, but we do not have unlimited access to the personal protective equipment that we would need to handle a surge. We've been taking advantage of this time period to actively acquire high quality PPE in the domestic and international markets. We have some ability to work with hospitals to provide and fill gaps that they have. But as you look towards that full surge capacity that you outlined, over 2,000 beds, that would take 2 to 4 weeks to come online, we would need additional success around acquiring personal protection equipment or risk going to crisis standards of care, which would mean reusing personal protective equipment for longer than their tested and certified use, which would put our healthcare workers in additional danger.
Hello, Governor. Jesús Carrasquel from Noticias Univisión. Gobernador, en español, ante el aumento de casos de COVID-19 y las medidas que han adoptado distintos gobiernos locales, ¿usted piensa cerrar de nuevo el estado, cerrar restaurantes, disminuir la capacidad, escuelas y algunos negocios?
Continuamos trabajando con los gobiernos locales para que se tomen las medidas necesarias. Esperamos que al tomar estas medidas no sea necesario tener que hacer cambios a nivel estatal, porque la situación es diferente en ciudades diferentes. Ahora es la más peligrosa en Denver, Adams County, Arapahoe County, pero continuaremos monitoreando esto cercanamente.
Hi, Governor. Mary Ann Goodland with Colorado Politics. The CDPHE sent out a notice today that 7 counties are now moving up in their levels, including several in rural Colorado. Just how many counties do you need to see at these much higher levels of restrictions before you feel like you need to take statewide action?
Well, we did take statewide action last week, limiting gatherings to 10 people or less with no more than 2 households. Essentially across the state. There are some protect our neighbors counties that are not under that, but in most counties, gatherings of 10 or less, no more than 2 households, that is effectively, essentially statewide. What you're seeing is different peaks and timing in different areas, Mary Ann. So you want to make sure you have the right response at the right time in the right area. And where you have active community transmission, you need to have stronger steps. Other areas of our state continue to have relatively low levels of transmission, and frankly should embrace that and enjoy that. And they're only a couple outbreaks away from their own lives being put in danger. But we treasure the time we do have, just as we had some lower rates over summer that allowed Coloradans to relax a little bit. Those times are over. Coloradans need to stay safer at home, wear masks around others, regardless of where they live.
Hi, Governor. It's Jessica Seaman with the Denver Post. When we're talking about hospital capacity, are there any hospitals in Colorado that are already at full capacity, including in the ICUs?
Let me see if I can go to Scott Bookman, who was having technical difficulties earlier, to answer that question. Scott Bookman?
Can you hear me now, Governor?
We can hear you, but we can't see you, but all we need is your voice. So go ahead.
Okay. Well, we'll start with that. At this point, we are seeing a number of our hospitals that are stressed. Some of our hospitals have had to manage their elective surgeries from day to day, but nobody is at the point where they're turning away patients, where we were thinking about crisis standards of care, but it is certainly a concerning situation at this time for some of our hospitals.
Thank you, Scott. And we did see you. We can see you now as well. Next question.
Governor Charles Ashby from the Grand Junction Daily Sentinel. So earlier this month, state officials closed 2 field hospitals, surge hospitals here in Grand Junction and in Loveland. And we've had just like over there in the Front Range, you have quite a few additional cases, not so much in the hospitals, but given what you just said and what Scott just said, do you think that was premature? Do you think those hospitals should be reopened? And are you considering even more stricter statewide rules on staying at home?
And to be clear, they were never open. They were prepped, but not opened, Charles, just to be clear. So the total surge capacity, and I'll have Scott get into this in a moment, but the surge capacity is about 2,200 beds. And they would come online over a 1 to 4 week period in different parts of our state at different levels of care. Scott will address kind of the one large one, and I think there's 2 smaller ones. We hope that those never need to be used. And frankly, if Coloradans do better, if they follow health guidelines in Mesa County, which is having in many ways the very first wave and large scale experience with this virus and can bring it under control, then none of those beds will need to be used. But they are there, and we're confident that that surge capacity would meet our needs, even if Coloradans were not able to make the changes that we need to prevent the use of those additional beds. Scott?
Thank you, Governor. We do still have a very significant amount of surge capacity at our alternate care sites across the state. The convention center is our large field hospital and will provide us with a very significant amount of capacity. At 2 other sites, at St. Mary's Corwin and the old St. Anthony's North Campus, we have built several hundred additional beds of more specialized capacity that is really around skilled nursing facilities. And so if we have a need to augment our capacity of our nursing homes or need to augment the discharge of patients from hospitals to nursing homes, we have that capacity as well. We feel strongly that we have all that we need and the capacity to go to that if the situation arises.
And we have a new data point for you, Charles. You can mute that, Scott. And Marianne might find this interesting too. We now show hospital capacity regionally. And Maria, if you could share that with Charles and Marianne. So we do this regionally. We look at, and not that people can at the end of the day be transported across regions. You know, Barbara was lifted in a helicopter and that can be done. But we'd rather avoid it. And so we are looking at this capacity issue regionally.
Hi, this is Erin Prater with the Colorado Springs and Denver Gazette. I know you've been asked this before, and I understand the importance of local control, but is there any situation under which you could foresee yourself putting the entire state, again, under a stay-at-home order? And then also, is there any talk of criteria regarding which patients might receive priority if we run out of hospital beds? I know they're having this conversation in Utah. Thank you.
So we do have very strong statewide health orders, and frankly, if people do a better job following those orders, then we will contain this virus. That includes wearing a mask whenever you're indoors around others, like in a store or an office around others. And it also includes no gatherings of more than 10 people or more than 2 households. If people follow those science-based statewide rules, then it will save lives and we'll get through this sooner rather than later. And Scott, you want to address the second part?
Yes, early on in the epidemic, our governor's emergency epidemic expert response council worked together to create our crisis standards of care, which is how our healthcare systems will ration care if needed. At this point, we do not have any anticipation that we will need to go towards those crisis standards of care. They were developed by an expert panel that included a number of different physicians, ethicists, et cetera, and they have been published. And we believe that by putting all of these measures in place, we will never need to go there, but they are available if we have to.
Thank you all for joining us. A special thank you to Clarence, Kim, and Barbara for sharing your personal stories with us and the general public today. And thank you everybody for joining us. Stay safer at home, wear masks around others, wash your hands, avoid gatherings. If we can do these simple things, we could do better here in Colorado, not just increasing our health, but also making sure that we can return to a greater degree of normalcy sooner rather than later. Thank you.